So today I'm with Dr. George Vito, the owner and podiatrist founder of Ankle and Foot Centers of Western New York. He has 4, soon to be 5 locations, one in Rochester, one in Cheektowaga, soon to be Buffalo, right, with Dr. Raul Vasquez's group at G Health Enterprises downtown, in Batavia, and here in Leroy.
Right.
That's pretty impressive.
Yeah. This is we go on a hub and spoke type
I like it.
situation where this is our hub. We have our own surgical center here. Plus, I do surgery at other locations. With we draw out from this area here, and then we branch out to this other locations. And we're not there full time. We're there 1-2 days a week.
Sure, sure.
And that seems to fit the needs of the general public more so than one location, like downtown Buffalo or Rochester, where patients have to come. Here, it's a good meeting place, and it's in between Rochester and Buffalo, Leroy, Batavia, and such.
Nice. So Leroy's the hub.
Yes.
I like that because actually Leroy was my hometown,
Okay.
so I feel right at home right here.
Oh, good.
Yeah, it's a good. I think
And
it's.
I
a
live
good
in
hub.
Leroy, so it's a good thing.
Perfect. Yeah, you
Yes.
have family here too,
Yeah.
right? Yeah. It's Jello Town. It's a great
Oh,
place.
yeah. Oh,
Yeah,
yeah.
good place. Where in Rochester?
I was raised in Greece.
Oh, okay. All right.
And
Nice.
then I went to med school in Iowa,
Okay.
and then my residency in Georgia. And I
Okay.
practiced there for about 23 years. And
Wow.
then we ended up here.
You came back to the cold weather.
Yes, so cold weather and
Oh.
Jello, so it's good.
Yeah, cold weather and Jello. There we go.
Yes.
What could be better?
Yeah.
Why podiatry?
Well, I was working on one of my masters in anatomy, and part of the rotation was with a podiatrist, and I did this in
Oh, okay.
Rochester,
Yeah.
and that's what stemmed my interest at that time.
Yeah.
And then as things progressed, and my training progressed and such, it developed more so. For I just don't practice of the foot. My license is expanded, and very few podiatrists in New York State have that license. So
Okay.
my license is foot, ankle, and leg. So
Wow,
I go up
that's
to the
impressive.
knee.
Yeah.
So then in my surgical center here, it's JACO certified. So whatever
Yeah.
anybody does in a surgical center, I can do right here also.
Wow.
So it works out great.
Impressive.
And we have anesthesia that comes in,
Nice.
and anesthesiologists that come in, and they perform the same service as they do at the hospital or surgical center.
Wow. So in saying that, that's funny. I was thinking, I looked at your bio, and you have a long list of surgical things that you can do. So I thought that's probably pretty advanced in comparison to most podiatrists that I've seen. So I thought, well, either you're really advanced or I'm podiatry ignorant. So.
Well, in the state of New York, there's 3 different levels of licensure. There's podiatrists that are licensed just to do foot. There's podiatrists that can do foot and some ankle.
Okay.
And then there's a license where you can do foot, ankle, and leg.
Okay.
And that's what I have. And so depending on the level of training, depending on where you're trained and such, will depend on what license they can grant you.
That's great.
And you have to provide documentation and such for certification and training and that type of thing to achieve or to get that high level.
Okay. That's pretty impressive.
So it works
Yeah.
out well for us here.
Yeah. Is that what led you to develop your own surgery center here, or was it just like a passion of yours?
Well, I always wanted to come back home.
Yeah.
And then the laws just recently changed in the past 6 or 7 years to allow podiatrists to expand the scope.
Okay.
And so once that occurred, that helped me
Mm-hmm.
to come back, and it works out well.
Works out well. That's great. So can we tour the surgery center in a
Sure.
little bit?
Yeah.
Show everyone how that looks? All right. With that surgery center, would you consider leasing to other providers?
Yeah, our license and our certification allows us to lease out space
Okay.
to whether it be plastic surgeons, orthopedics, the general surgeons and such. And depending on the cases and such, it's much easier to come here. The
Yeah.
risk is much lower, and
Absolutely.
the
Easier for the patient?
yeah, it's easy in, easy out. You park right outside, and it works out very well.
So then they would be able to utilize the anesthesiologist
Yes,
that
yes.
you do?
Oh, yeah,
Okay.
and all our instrumentation and such.
Oh, that's great. That's perfect. So anybody that's interested in leasing space should definitely get in touch with Dr. Vito. That's great. If you could do it all over again, would you still choose podiatry?
Yes, I think. Yeah, I know I would.
You still
It's
would?
been very rewarding, and
Yeah.
and I enjoy going to work in the morning.
Mm-hmm.
I
That's
enjoy
great.
meeting patients and such. And I have my practice isn't just surgery; it's everything from wound care, from diabetic education, from nail debridements and such, all the way up to reconstructions of the ankle and lower leg and such.
Oh, wow. So you also go to nursing homes as well,
Yeah,
right?
we do nursing homes too.
Yeah.
And that's rewarding, and you're meeting other people, you're meeting nurses and such.
Sure. It's a busy guy. Busy guy. So for new grads, or soon-to-be new grads coming out of podiatry school, what advice would you give them?
Well, it's training. Make sure you're trained, and make sure you understand your choices of what practice you can go into.
Mm-hmm.
So many aspects of podiatry now, they would want to bring you into a hospital situation,
Mm-hmm.
or they bring you to a practice that's run by the hospital.
Mm-hmm.
And then, but if something doesn't work out, then you're left on your own with no business, no idea of how to run a business.
For sure.
So, the big suggestion is learn how to run a business.
Yep.
Because if you can't,
I love that.
you're strong-armed into working for somebody else. And then if that doesn't work out, in about 60-70% of the time it doesn't work out.
Correct.
That if you work for a hospital or a big corporation, you have to go out on your own.
Yep.
And if you can't do that and have no idea how to function,
You're in trouble.
Yeah.
So then you would encourage private practice.
at this point, and a lot of practices who have been bought
Mm-hmm. Are not so happy.
and not so happy, and the doctors are getting back out and going into private practice.
Yep, for sure.
And what they thought the grass was greener, it's not.
It's not. Nope.
You got, instead of an office manager, you have 15, 20 office managers that hold more authority than you,
That's right. Yes.
and they call the shots, not not the physician.
And all of the promises that they gave you before you signed,
They're
not there after you signed.
Or it may be there for 1 or 2 years, and then they wdraw.
Yes. Yeah.
For one, then they make, and they'll substantiate their withdrawal of money for one reason or another. They'll pass, they give you a bunch of numbers and graphs and such, and you may not know what they're talking about.
Yeah.
They may try to substantiate one way or another, but they have the purse strings.
Yeah.
They have absolute control.
Yeah. I'm definitely a proponent of private practice.
Yes. I mean, and things are going back to that way. It's difficult, it's challenging. However, it's rewarding, and you're not worried about coming in one day and having a pink slip.
That's right. Yes.
And it happens all the time. It just happened very recently to a couple docs out of Batavia
For sure.
and Buffalo, and they're devastated. They don't know what are they going to do.
Yeah. You get to control your destiny
Yes.
when it's your own, and you're still happy. Like you said, you still look forward to coming to work every day.
I mean, it's a challenge,
It's a great place to be.
and it's good, and I enjoy it.
It's a very important question. Where's the best place to eat in Rochester?
Rochester, I was just talking to somebody today about a tripe. So Rockies, I think, downtown is good. Red Fideli's on Ridge Road is very good.
Yeah.
And there's little niches. Mr. Dominic's up at the lake, and I think there's a secondary one, I think in Gates or someplace. But there's
some good places to eat, right? Yeah.
Batavia has some good ones.
Yeah.
And Buffalo,
Leroy,
but Buffalo also has some great.
Absolutely. I keep hearing about the Sweet Betty's in Leroy.
Sweet Betty's is very good, and great coffee, great desserts, great sandwiches.
Nice. I was a big LB Grand fan, so I'm so sad.
Yeah, that they
best spaghetti in my opinion.
Well, that LB Grand was good, and as I heard, so was the casino, but that was before LB Grand.
Yes. Yeah.
And
that's true.
Again, we were just talking about today who had. And each one of them had a different type of sauce. One was a little sweeter, one was not as sweet.
LB Grand had the sweet sauce.
Yes.
Dali Piazza, she also had the best cake in the world.
So, I mean, it's Leroy, and it's a good place.
Absolutely. Can we take a look at the surgery center?
Sure. We have full anesthesia, instruments and such. We have full arthroscopy.
Wow.
And that allows us to do ankle arthroscopy on endoscopic procedures of the foot and ankle.
Wow. That is
usually
impressive.
that's only limited to the hospital, but we have full equipment for that.
Wow.
And that allows patients to resume activities much, much quicker.
Okay.
Very similar to heel spurs and ankle pain and that type of thing, where instead of opening up the ankle, we just go in with a small instrument and just look around and then clean out the joint with small instrumentation, and their patients are walking right away.
Such a better experience than going to the hospital.
Oh, yes.
Now you're also...
safer.
You are operating at the Amherst Surgery Center, right? Yep, in Buffalo for those
More bigger
patients.
cases up there, and patients love it up there, and it's a great facility, and the nurses are great, and everybody works well.
That's great. see if we can just take a little peek around the room. You can just see it's really simple room. And oh wow, supplies, everything. So anyone that wanted to lease here, that would be a good, really good gig. This is great. Awesome. Well, thanks, Dr. Vito. Appreciate it.
Yes.